Hi, this is Tonya Nabelia, and this video is about Bimanual pelvic exam and rectovaginal exam. This examination is used to thoroughly evaluate the patient's cervix, uterus, ovaries, rectum, and other pelvic structures. So before doing the procedure, explain the procedure to the patient, obtain consent, let the patient empty her bladder, and ensure the patient's privacy. And position the patient in a dorsal thotomy position. Now let's begin. Inspect the mons pubis, labia majora, labia minora, and perineal body for skin characteristics, hair distribution, contour, and swelling. Check the clitoris and note the size and shape. Observe the introitus and take note of its hymen if it's intact, imperforate or open, and whether the perineum gapes or remains closed in the thotomy position. Inspect the perianal area for evidence of hemorrhoids, sphincter injury, warts, and other lesions. The gloved hand then palpates the area of the posterior third of the labia majora, placing the index finger inside the introitus and the thumb on the outside of the labrum. Gloved hand holding the labia apart, the opening of the vagina should be inspected. Evaluate for pelvic organ prolapse. Put lubricant on both index and middle fingers. Introduce the well-lubricated index and middle fingers of the dominant hand into the vagina, directing them posteriorly. The thumb should be pointing up or folded under to minimize discomfort for the patient. Test the strength of the perineum by pressing down on the perineum, asking the patient to bear down. The opposite hand is then placed on the patient's abdomen. Press the abdominal hand on the infraumbilical area. Very gently press downwards, sweeping the pelvic structures toward the palpating vaginal fingers. Evaluate the uterus for position, architecture, size, shape, symmetry, tumor, consistency, tenderness, and mobility. Also, evaluate for the cervix for its position, architecture, consistency, and tenderness, especially on mobility of the cervix. Place the fingers on the right lateral fornix and do the same on the left adnexal region. Next is the rectovaginal exam. Withdraw the middle finger from the vagina and insert into the anal canal while index finger remains in the vaginal canal. Evaluate the tone of the external sphincter muscle, tenderness, tumor, irregularities, fixation or mobility of the rectovaginal septum and rectum. Remove and examine both fingers for evidence of gross blood, purulent material, and other alterations in color or consistency of vaginal discharge and stool. Properly annotate reported findings such as introitus, cervix, uterus, adnexa, discharge, and rectovaginal exam. Thank you for watching this video.